As I have communicated over the past several weeks, the Delta variant has emerged as the dominant strain of COVID-19 across our country, including here in Boston. The Delta variant spreads faster and is easier to catch. As a result, we have seen public health metrics trend up over the past several weeks. Strong public health measures and the responsible choices of individual residents in Boston have kept our key health metrics well below threshold levels and below the peaks of 2020. The arrival of the fall brings an influx of more than 50,000 college students into Boston from all across the world, and another 50,000 students are preparing to go back to school, many of whom are young learners who are not yet eligible to get the vaccine. Many workers will also be returning to offices after Labor Day. In light of these changes among our population and the recent urging by the CDC for indoor masking in Suffolk County, we are implementing a number of proactive public health measures to further protect the people of our city. I want to thank my dedicated team of cabinet chiefs and their staff who all helped to roll out a robust plan to protect all Boston residents from the devastation of COVID-19. I also want to thank the hospital CEOs that I've met with for their engagement in this work. Boston will continue to lead the region and the nation in our response to the pandemic. This response includes a 5-point plan for mitigating the impact of the Delta variant, including: number 1, equitable vaccine and booster access for everyone. We know vaccines are the best way to protect ourselves and those around us. Boston has become one of the most vaccinated large cities in our country because of the work that we have done together. Over 68% of residents have at least one shot. In the last 2 weeks alone, nearly 8,000 residents got their first dose of the vaccine. Our latest efforts have helped to narrow gaps in the Black and Latino community as well, with a 21 percentage point increase in the Black vaccination rate and a 30 percentage point increase in the Latino vaccination rate since we began our vaccine equity initiative. This is a sign of the progress that we are making together. Number 2, a vaccine mandate for city and workers. By the end of August, all city employees, contractors, and volunteers will be required to verify their vaccination status through a secure, centralized digital portal. We engaged cabinet chiefs, department heads, and labor leaders in the discussion as we developed a worker-centered approach, beginning with our employees who work with high-priority populations like our school staff. Number 3, new HVAC investments for our schools. We marked the reopening of our schools in the spring, and we're preparing for another safe school year of in-person learning. Along with the dedicated work of our school teachers, custodians, bus drivers, and administrators, we must continue to invest in healthy school buildings. We are committing $30 million to improve heating, ventilation, and air conditioning in our school buildings over the coming school year. Number 4, a mask mandate for schools and city buildings. We have led by requiring masks in all of our municipal buildings, including BCYF, libraries, and schools. Number 5, a new mask mandate in all indoor spaces that are open to the public. We must do all we can to protect Boston residents with strong preventative measures, and masks work best when everyone wears them. They protect those who wear them and those who are around them, including people who are most vulnerable. Boston is home to more than 100,000 children, most of whom are not yet eligible to get the vaccine. This public mask mandate will help limit transmission of the Delta variant and boost public confidence that is essential to our continued economic recovery. I commend the venues and the businesses that have already adopted their own mask requirements. This new public health order makes wearing a mask simple, clear, and consistent across the city. If you are inside a building that is open to the public, wear your mask. If you are not eating or drinking, wear your mask. This public health order will go into effect on Friday, August 27th, 2021, with operational guidance available today for businesses and venues. This 5-point plan for the Delta variant places prevention at the center of our COVID-19 response. We will continue to employ a comprehensive, data-driven approach to the pandemic. I ask that every resident of Boston do their part to keep our city safe.